thank you all for joining us for this meeting or the town hall to share the recommendations of the Social Justice Action Committee. I want to start by thanking the 60+ members of the Pitt Public Health community that participated in the Social Justice Action Committee and the work groups. You've created an amazing body of work in a very short period of time. I also want to extend my special thanks to the SJAC, that's the acronym for the Social Justice Action Committee you see on this first slide, and for their leadership and for their time and dedication and for again, the incredible work that they've done to really create a roadmap for the school going forward. And that's Noble Maseru, Tina Hershey, and Brenda Diergaarde. I also want to thank Jay Hughley, who's joining us today from the School of Social Work, who will serve as a moderator for our discussion. You know, let me just say that social justice and racial equity are at the core of the mission of public health. Yet, the events of this summer, the spring, and actually things happening around us that continue to happen today make it clear that we as a society, as a university, and as a school are falling short of carrying out this mission. You know, in short, I would say to you, we have to practice what we teach. I like my grandmother used to say, you have to practice what you preach, but we're in the academic arena, we have to practice what we teach. And that really is the underpinning of what we're doing with the Social Justice Action Committee, this town hall, and the steps we're going to take going forward. You know, while the dean's office and the chairs of the departments in our school expressed our outrage and vowed to renew our commitment to social justice, those words, you know, I think as important as they are really meaningless unless we take action. You know, I'm heartened by what I've seen with the university and the Senior Vice Chancellor's office and what's going on in the other health sciences schools. Initial steps are being taken as an institution, steps around hiring, around scholarships, around curriculum. And so I think we can take some, I guess, excitement about that the university is starting to practice what it's teaching, but we have to do that. We have to take care of our own backyard and make sure we're carrying out our mission as well. I think I just want to finish by saying I and the chairs of and the entire school leadership are inspired by the remarkable work of the Social Justice Action Committee. We look forward to the discussion today, and we look really more forward to implementing the comprehensive set of recommendations which you're going to hear about and discuss. So thank you for your continued good work. And I believe Dr. Maseru is going to take us through some slides about how we got to today and help set us up for this discussion. So thank you, Noble. Thank you, everybody, for participating.
And thank you, Everett. Good morning, everyone. Before we begin formally, let me just first off begin by saying vote. Public health is voting, so vote. Our agenda today will be, as noted, our Interim Dean Everette James has just provided our remarks. I'll offer some comments on how we got here. Tina Hershey, my colleague on the leadership, Social Justice Action Team leadership group, will provide comments on the process. And my other colleague, Tiffany Gary Webb, who's also a member of the SJAC leadership team group, will provide the recommendations of the respective 10 work groups. And then James Hughley, who is the interim director for the Center for Race and Social Problems, will lead us and moderate the open discussion. And then Tiffany Gary Webb will provide us with the next steps. So now our conversation this morning would not be taking place without the social protest in the streets that is occurring while we speak. And I'll ask Tiffany if she would, the social justice action work, which we will be discussing with you, is a continuation of the people's movement for social justice, human rights. We also acknowledge this space, Pittsburgh, state of Pennsylvania, was once that of Native peoples. And as many of you know, racism has been declared a public health crisis by the American Public Health Association, as well as through resolutions adopted by the city of Pittsburgh in Allegheny County and over 50 other jurisdictions. However, before we attend to the SJAC report, context is important. Consequently, a brief look at the past will provide insight on establishing social justice and more equitable policies at Pitt Public Health. Persons of African descent have endured racial oppression, brutality, and terrorism in what is now the United States since the first enslaved Africans arrived here in 1565 at St. Augustine, Florida. Slavery was legally abolished in 1865. However, African Americans and persons of color are still subjected to terrorism, violence, and de facto segregation and racially motivated violence to reinforce white supremacy. Other instances of white supremacist de jure actions are the Chinese Exclusion Act of 1882, the lone law in the United States that prevents a specific nationality from immigrating to the United States. The Indian Removal Act of 1830 is the resettlement of Native people to land west of the Mississippi. Japanese internment in 1942, more than 112,000 of the 127,000 resident Japanese were placed in concentration camps. This occurred immediately after the attack on Pearl Harbor, and coincidentally, German Americans were not interned. Jewish quotas and anti-Semitism in universities and social life was widespread in the 19th and 20th century. In 2015, inhumane treatment of migrants on the US border with Mexico in detention cells that some call freezers is still documented today. It was estimated that 6,500 African Americans were lynched between 1865 and 1950. Lynching is a murder outside of the judicial process. On August 28, 1955, a 14-year-old African American boy was snatched from his uncle's house in Monee, Mississippi, and forced to remove his clothes. He was brutally beaten and his eye was gouged out. He was shot in the head and his body was thrown into the Tallahatchie River, where his body was found 3 days later with a cotton gin fan tied around his neck with barbed wire. 30 days later in September, an all-white jury found the two white men who abducted Emmett Till not guilty. On November 22nd, 2014, a 12-year-old African-American, Tamir Rice, was shot on a playground in Cleveland, Ohio by a white police officer. The policeman was not indicted. On February 23rd, 2020, African-American Ahmaud Arbery, 25, is shot while jogging by a white man. And this case is still open. On March 23rd, 2020, African-American Breonna Taylor, a 26-year-old, was killed in Louisville, Kentucky, when Louisville police forced entry into her apartment while she was sleeping. None of the officers have been charged with her murder. One officer was charged with shooting the neighbor's wall. On May 25th, the world witnessed the horrific murder of 46-year-old African-American George Floyd by a white police officer who has been charged with second-degree murder. The extinguishment of his life was a visual articulation of racial injustice, systemic oppression, and white supremacy in the United States. 8 minutes, 46 seconds. These killings led to worldwide protests against police brutality, racism, and social injustices. The outrage expressed by community folk found its way to campuses around the country. Chancellor Gallagher, Pitt University deans, as well as our own Interim Dean, Pitt Public Health Interim Dean Everette James, received demands by students. In mid-June, we had a faculty retreat where we added our voice condemning intentional actions of anti-Black racism, not only externally, but in Pitt Public Health. For example, it took 60 years before an African-American received tenure at Pitt Public Health. It took 70 years before an African-American woman received tenure, and that's our own Tiffany Gary Webb. And Pitt Public Health faculty have been utilized to assist in the COVID-19 pandemic response at the Allegheny County Health Department. However, African-American faculty were rebuffed by the Allegheny County Health Department. Dr. Tiffany Gary Webb is the chair of the APHA Epidemiology section, and Dr. Dara Mendez is the recipient of a National Maternal and Child Health Practice Epidemiology Award. Yours truly has administered 2 city health departments and have more experience in infectious disease management than the ACHD leadership team combined. Moreover, when we asked Pitt Public Health leadership to write a letter to the Allegheny County Health Department director expressing their disappointment in African-American faculty not being utilized, they declined to do so. My remarks in the 2019-2020 convocation, quote, "For those who elect to do so, we applaud your commitment to social justice," unquote, was expunged. When we made our remarks at the faculty retreat, I mentioned a plaque that has Thomas Perrin's name amongst others in the dean's office and recommended replacing it, or at least at minimum, cover over his name. If it's still there, it's indicative of why the SJAC work is vital. As Dr. King stated, justice too long delayed is justice denied. African Americans, persons of color, and other marginalized persons are fighting nobodiness. What took place 400, 250, or 65 years ago to what's happening today is not in a vacuum. We take the words of our late Congressman John Lewis at heart. You see something, do something. This is not a time to be silent, but to take action, to make good trouble. So in closing, we condemn the pervasive and willful choice that many make to participate in anti-Black racism in Pittsburgh, Allegheny County, and the United States in general. We at Pitt Public Health must explicitly name systematic oppression and white supremacy as root causes of anti-Black violence. We must, as our dear friend Bill Jenkins, our late Bill Jenkins challenged us to do at the symposium on Thomas Perrin, say racism. We must, as our colleague in social justice advocacy, Kamara Jones, fulfill 3 tasks in combating structural racism. Name racism. How is racism operating here? And organize and strategize to act. The SJAC is our strategic response to act against systemic and structural racism. To see it, name it, and remove it. We provide actionable recommendations that must meet 3 criteria. Address systemic racism. The recommendations must be quantifiable, and the recommendation must have a timetable for accomplishment. What Pitt Public Health does externally matters much, but what it does internally matters more, because the organizational culture and environment is a reflection of its values. Social justice is a core value of public health, and we at Pitt Public Health must expressly fight against anti-Black racism, xenophobia, and racial injustice in general, and dismantle the structures and mechanisms that harm the Black community and other communities of color. We must take actions that reflect our values of the National Public Health academic and practice community. APHA, NACHO, ASPPH, ASTO, and CEF. The SJAC report is a purposeful, lip service, window dressing, and tokenism is unacceptable. Moreover, it's time that Pitt Public Health devote resources to this vital anti-racist and social justice mission. Systemic racism and structural injustices are not going away automatically. The SJAC report provides accountability. It's a blueprint for equity and social justice at Pitt Public Health. This town hall is our commitment to maintain transparency. The struggle continues and advances. And now my colleague and fellow SJAC leadership team member, Tina Hershey, will talk about the process. Thank you.
Thanks, Noble. Yes, I'm very happy to be here with you this morning and to walk you through the process that we went through this summer to that led to this report. So as already established, Interim Dean James asked Noble Maseru, the Associate Dean for Diversity and Inclusion, and Brenda Diergaarde, and myself, who were the co-chairs of the Faculty Diversity Committee, to lead the anti-racism and social justice efforts here at Pitt Public Health. And here is our charge: to confront systemic and structural racism at Pitt Public Health and beyond by developing systemic solutions and actionable recommendations that the school will implement to achieve social justice and racial equity and bring about transformative change. Next slide, please. So the 3 co-chairs invited other members of the Pitt Public Health community to join our leadership team, and they are listed here. Next slide, please. And in the leadership team, we included faculty, students, and staff. So this slide captures our timeline. I'm going to walk through some of these steps in more detail, but just so you see, this is our summer in a snapshot. So at the end of June, the SJAC was initiated, and we invited the other leadership team members to join, as I just mentioned. So in early July, we established our operating framework and our timeline, and we invited participants to join us in work groups. And so those work groups, for about 2 weeks in July, worked together, and more than 60 members of our community came together to form these recommendations. And then we also have this Qualtrics comment box that I will address in more detail. And then in a very, very short window, we, as the leadership team, wrote the report and presented the recommendations to the Pitt Public Health leadership, and then submitted a final report to Dean James on August 11th. Next slide, please. So a little more detail about this process. So as I mentioned, we formed these work groups. So our community members were invited by email to join us. and they were randomly assigned to various work groups. So we had 3 domains: culture, HR hiring, and curriculum, and then 3 subgroups: student, staff, and faculty. And then there was an additional heterogeneity work group, which worked across domains and worked across subgroups. So we assigned an SJAC leadership team member to each work group to facilitate the conversation, kick off the events, and just assist in any way that they felt was necessary. So we asked each work group to meet several times over a 2-week period to develop actionable recommendations, including accountability metrics and a timeline, as Noble just mentioned. So again, we had 10 work groups formed with more than 60 members across our community. Next slide, please. So I mentioned this Qualtrics box. We realized that not everyone would be able to participate in a work group, either because of time or because they were uncomfortable putting themselves out in public. So we allowed for an anonymous comment box through Qualtrics to allow individuals to share their experiences and recommendations anonymously if they desired. They were also able to give us their name if they chose to. So we received 27 comments via the Qualtrics box. Next slide, please. So as I mentioned, we developed a report, the recommendations of the SJAC work groups. So we compiled the recommendations, and that's the report that we're going to talk about today. The recommendations from the work groups as well as from the Qualtrics comment box. Our edits were very limited. We compressed similar overlapping recommendations into one, and then we also edited language, but the recommendations you see in the work group report are those from the work groups. We, again, did not do editing. And so perhaps there might be some more refinement that needs to happen, and that's one of the reasons to have this town hall, is to really work on those recommendations and to prioritize and think through what we want to do as a community. And as we've said over and over again, we are so proud of the number of people that came together to work with us over the summer, again, in a very short time period. And so here's a quote from our report. The level of consensus and collaboration, as well as the willingness to devote considerable time and energy to this work across work groups and the SJAC leadership team, is inspiring. We were truly, truly inspired by the work groups and the recommendations that they developed. Next slide, please. So again, we presented our work to various leadership members. So on August 4th, the draft report was presented to Interim Dean James and the department chairs. On August 11th, after we finalized our report, we submitted the report to Dean James. And then on September 14th, our leadership team met with the Senior Vice Chancellor to present our recommendations. And at each step along this way, the reception that we received from leadership and the Senior Vice Chancellor was truly welcome and open to the work that we want to do, to changing our community, to bring about this transformative change, and to really realize the SJAC charge. So thank you for your time. Tiffany, over to you.
Thank you, Tina. So I just want to take this time to thank Dr. Maseru for his leadership as the former Associate Dean for Diversity and Inclusion, and to thank the Social Justice Action Committee for their work. The recommendations were pretty much out of this world, and I'm so grateful that there's a group of people who are committed to thinking about this work moving forward. So as you know, because you've been able to see the report and hopefully you've been able to review it, we have a lot of recommendations. So over 200 recommendations were put forth as part of this process. And so today, I'd like to just provide a little summary coming from our leadership team and coming from discussions that we've had with the leadership at Pitt Public Health and the health sciences, to really figure out priorities and hone it down to things that we can implement right away. So I'm going to give you a brief summary of some of the recommendations, and then I really want to hear from you about what you thought of the report and your recommendations for implementation moving forward. So in the section of culture, there were several recommendations that called for an expansion of the Office for the Associate Dean for Diversity and Inclusion. So adding program staff members, and as I would like to see it, this office to be as core of a function as student affairs and other functions of the school. And so having staff to support that, having staff liaisons liaisons. So there was the idea of having equity allies from each department, and then also making the office big enough to be an actual Pitt Public Health Office of Diversity and Inclusion. One of the other recommendations related to culture is conducting an equity assessment or audit of the school to determine areas for further attention. And so this is something that's come up from a lot of different units. I know epidemiology is thinking about this. And so we are thinking about this also across the health sciences as to how we can get a baseline assessment of where we stand and some of the things that we need to work on moving forward. As part of culture, we'd also like to work on creating new pipeline programs to increase diversity, to improve diversity of students and trainees. So we have initiatives coming out of EOH, the Underrepresented Minorities Research Enhancement Program, a program that tries to build on some of our existing pipeline programs, such as the Investing Now program in the School of Engineering, which we do participate in with high school students. Dr. Maseru has been working on having a memorandum of understanding with Jackson State University, one of the only historically Black universities that has a school of public health, and seeing how that we can have some cross-learning between Jackson State and our institution. And then overall, we want to create a culture of transparency, not only regarding some of the racial tensions that we've seen and talked about and Noble talked about, but also in support for recruiting underrepresented minorities at all levels. With respect to hiring and HR and across really the content domains, we really want to take actions in recruiting and mentoring and increasing the diversity of the Pitt Public Health community. So some of the ideas that have come forth are restructuring rubrics for faculty advancement so that we can really recognize the value of community and social justice work. There's an idea to develop a cluster of faculty positions of people working at the intersection of social justice and health equity, research, practice, and education. And that cluster higher focus is being implemented at the university level. And we just actually had a meeting this morning to discuss that. And then we really want to recognize that in addition to recruiting new faculty, we really want to have efforts to retain and sustain the growth of current students, faculty, and staff. Okay, and then throughout all of our content areas, we want to evaluate, collect data to really hold ourselves and our university accountable. So a couple of ideas on how to do this are to establish processes. So either some committee or some external review body that will help us review progress on our social justice action items over time. One of the things we're also considering is doing a website, so similar to what the university is doing, a website where people can track our progress and track our activities as a way of holding us accountable. We also want to have specific targets for diversity. So determining the percentage of diversity expected in the next 5 years, and then looking at how we make progress toward that goal. And throughout being transparent and having the data and information accessible to the Pitt Public Health community. We also want to create new scholarships and fellowships for more people to be involved, recognizing that we always can't hire people into permanent positions, but we can create things like visiting fellowships and scholarships to bring talent to our university. And finally, with respect to curriculum, we want to review and update our current curriculum from a number of different levels. So looking at all of our curriculum for additions on anti-racist work and CEEF requirements, We want to directly address some of the impact of the past and current actions that have caused distrust towards public health and medicine. So we're doing some of that work and thinking about, even in renaming our school, from Thomas Perrin, who was involved as Surgeon General with the Tuskegee syphilis study, and thinking about how some of those actions in the past impact current events and how we address that. Another idea has been to update the course evaluations to really track the success of our work and change in the curriculum over time with the students. And finally, to expand our One Book, One Community program to include books and journals and documentaries on anti-racism by authors of color. And we've already started to implement this as the process this year. The community can actually vote on the One Book, One Community this year. Okay, so that is a brief summary of the recommendations from the SJAC leadership perspective. Now I'd like to turn it over to Dr. Jay Hughley, who's the Interim Director of the Center for Race and Social Problems, to lead us in a discussion of what you think about the recommendations and what you think priorities should be.
Dr. Gary Webb, thank you. And by you, she means us, so not just me, in terms of our thoughts on these recommendations and priorities. Thank you for everyone coming out to this important event at the School of Public Health. I'm excited and honored to be a part of this discussion and to help facilitate some of the thinking on what's important to everyone here. I want to thank Dean James, Dr. Maseru, and Dr. Hershey, and Dr. Diergaarde, and the entire Social Justice Action Committee for embarking on this work, and Dr. Gary Webb, who I did not know was the first Black woman ever tenured at the School of Public Health, which is deeply congratulatory, but it's also a very symbolic moment, and tells us, the amount of work we need to do here and in other places in the university. And so, this committee has accomplished an incredible amount of work in a short time. We're working on these issues in social work as well, and what you've been able to do is quite remarkable. So thanks to all of you that have contributed. At this time, if you have not already, I don't see anything in the queue in terms of questions or in the chat. So if any of the attendees have questions or comments, please start to populate the question and answer or the chat. I just want to make sure for the moderator that is in fact open to attendees. But I myself, at this point, have a couple of questions that I can direct based on what I've learned about the work you're doing. And the first one that I would direct to all of the leadership around these issues is around this issue of power and power dynamics and how that plays out when we think about this work around equity and justice, around race and other domains as well. And when you have issues that relate to, that run across, say, a junior faculty member or a senior faculty member, or a student and a faculty or staff member, and there's a power dynamic at play. When you think about your recommendations, how do you feel like they speak to resolving those kinds of challenges in the school as they emerge?
So I can just start with that one. So I think our goals of recruiting more faculty and more diverse faculty will help with that issue. One of the challenges, so mentioning the fact that I'm the first tenured Black woman tenured in the school, we see that overall that once you move into the higher ranks in the university, higher leadership ranks, there's less proportion underrepresented and women in those positions. And so even just having Dr. Maseru at the professor level was instrumental in helping move some of our culture forward, because he was able to be at the table And so now with me taking over this position, I am able to be at the table, but the reality is we need more of us at the table. And so our recruitment goals directly, I think, will impact some of those dynamics.
I see Dr. Maseru coming in. Were you going to comment on that as well? You're muted. You're
on mute.
Yeah, no, I was trying to get out of it. No, actually, there is an additional comment or a question in the chat that from Ambrose Zandria Ambrose, who says that I am a secondary faculty member in GSPH with a primary appointment in another school. I've been disappointed in my school's response in this area. Do you anticipate these recommendations being adopted Pitt-wide? And the answer to that is an unequivocal yes. In the health sciences, the Senior Vice Chancellor, Anantha Shekhar, has established several appointments, including my own, which is responsible for social justice and racial equity and faculty engagement in all the schools of health sciences. With that work, it's our intention, as we have done during our service at Pitt Public Health, is to have a collaboration in the liberal arts as well. And that obviously is represented here with Dr. Hughley as our moderator, to have greater collaboration with other disciplines outside of the health sciences. So yes.
And I would add to that, being at the Center on Race and Social Problems, we're interdisciplinary and we collaborate with people across the university, and I'm on some of the university-wide committees. I think the messaging is very clear that we need to work on these in our independent schools and units, and I think everyone is trying to move forward. And are at different places in different schools. And so I think that public health, as far as what you've laid out in terms of these recommendations, is probably at the forefront of this work, and is going to be a model for other units as well. I see a related question, and it says, it's great to see the internal processes the school is focusing on, and thank you for this work. Are there future aims to direct the talents of the faculty? All right, this is moving. Direct the talents of the faculty and the students and the legitimacy of the institution to engage these issues in our local communities. So how do we connect this work that's happening here in public health to similar issues in the local community?
Did you want to take that, Tiffany, or?
No, go ahead. Go ahead.
Okay. Tina, did you want to grab that one?
No, but I think you're best positioned to answer that question.
Okay. So yes, in all the work that we do, we will definitely have strategic partnerships and collaboration with the public sector agencies as well as community-based organizations. We mentioned the racism as a public health crisis. Those two resolutions that were initiated or put forth in Allegheny County and the city of Pittsburgh, it was through a collaboration of the work that we were doing at Pitt Public Health. Dara Mendez was involved in that work. Richard Garland is doing work around the returning citizens. Lena Dunstelio is doing work in the community engagement centers, and those centers are linking up with the work that we're doing at the university-wide, as well as work that Paula Davis is now beginning to put together with health sciences schools and other agencies. And I'll just give an example specifically around the agency piece, the Pittsburgh Water and Sewage Authority. We had the privilege of serving on the Water Equity Task Force, and one of the areas that we were able to advance and put forward was around a living wage. As many of you who travel through Pittsburgh, you see that the work crews on these lead service replacement lines do not represent the communities that they are working in. The bottom line is that now we have initiatives with PWSA, along with the Pennsylvania Utility Commission, who are putting forward a requirement for representation of a workforce that reflects those particular communities. And the reason that's valuable or important is that those individuals who work on those work crews, the average hourly wage is around $30 per hour. And we know that the minimum living wage is around $15. So we're talking about $30 per hour for folks who are working in those communities. And again, I have to applaud Richard Garland and what he's doing in terms of assuring that when people are released, returning citizens, that they too are going to be included in workforce development initiatives that provide sustainability around living wage salary. So those are two examples right there where the academic and the public sector, where we're involved in the public sector and community-based organizations.
Thank you for that response. We have a question coming in that says, is the assumption here that anti-Black racism will go away if we have more diversity in our school? Someone at one of the sessions said that slavery was diverse and inclusive. Are there steps in between where we are now and this future graduate school of public health to address anti-Black racism as a predominantly white faculty and student population? So what is the bridge between the diversity goals and, I think probably speaks to the ideas around cultural change?
Yeah, exactly. That's exactly what I was going to say, Jay. So we've been very clear, at all levels, the university, health sciences, and Pitt Public Health, that we can't just recruit a diverse faculty into a culture that is not welcoming and inclusive. And so that we have, in concert with the recruiting, that we've got to do a lot of work on culture. And so we've started some of the anti-racism activities. So some of you know that at the university level, the university is now requiring anti-Black racism for all students, first-year students. And so that is really supposed to provide a basic understanding of some of these issues, expose the students to that material, and then hopefully they will want to learn more and take other classes and have more targeted learning during their time here at Pitt. So that's just one example. Here at Pitt Public Health, we want to do some anti-racism trainings for our entire community, but we're going to start with the leadership because we have, including this one, we have a lot of conversations from my perspective that we need to have to not only like what Noble said, to name racism, because we do still have members of our community who don't think that we have a problem here. So name racism and then be able to reconcile and move forward. So others may have things to add, but it's not just about increasing the numbers. It's a very, very holistic approach to deal with the culture, the hiring, and with our curriculum and education, ongoing education for everyone, not just students.
I can just chime in here. I think it's also important to recognize that the faculty that work on service in this area need to have their time credited for them. So, we've talked about this a lot at the SJAC, that, it's grant dollars that are really what we're credited for. And so a lot of this work is not. And so changing the culture around that, I think, is really important. So, a lot of the service time that we put in here takes away from our ability to maybe write papers or get grants. And that, I think that needs to change. And that's sort of a cultural shift. And that's across, I think, across the university, across the schools. And I also just want to add, there's a lot of questions about timeline that I'm seeing as I'm sort of going through, the corner of my eye, seeing the chat, seeing the Q&A. So I think it's really important that we address the timeline questions. I think there's some things that we can do quickly, but there's also kind of a purpose for this town hall is to find out what your priorities are. So if people can start chiming in about the priorities, about what they want to see going forward, I think that would really help us develop a plan. We have this report, we have these 200 recommendations, but we really need to find out what your priorities are so that we can really move forward.
I want to repeat a comment that someone sent in. It seems critically helpful to make the anti-racism training available to faculty and staff, given all of the students we access. And, I think we second that in our department as well. A question that has come up: how does the recent retirement of faculty and staff factor into the implementation of diversity hire recommendations?
So that's something that I can't answer directly. Dean James may want to chime in on that, but what we're trying to do, and so I know there was another question specifically about cluster hires. And so that type of thing is actually in development. So what we are doing is working with Paula Davis and John Wallace and others, a committee across the school, to think about how we can hire a cluster of faculty across different units, and each unit may have their own needs, so they will create proposals for what their particular needs are. So that's kind of the basis for the cluster hire. But what we have been doing is trying to see what resources come from the university and the health sciences, and then we'll know a little bit more specifically about hiring within our school. But along with that, I think one of our first steps for our school is we as a school need to determine what our diversity targets are. Okay, so I think right now we are at about 6.5% for Black faculty. We're at about 16% for underrepresented students. So really trying to figure out some targets for where we need to be, and then all of the different mechanisms for hiring. So from the cluster hires to our regular lines and so forth. Dean James, did you want to chime in on that one?
Yes, I didn't even know I was a discussant till you called on me, Tiffany. So here I am. So I think the retirements have, we've lost a lot of institutional memory and a lot of experience in the school. I think we ended up having 58 staff retirements and a handful of faculty retirements. So there will be hiring. I think there's no way the school can function without a certain level of personnel. And so there's going to be quite a bit of hiring, which does give us an opportunity to increase diversity in the faculty and staff ranks as well. So yeah, I think it creates a great opportunity for the school to increase diversity. And as you said, we are, all the schools in the university, and frankly, all the schools in the country, are trying to figure out what the benchmarking really is and how you benchmark your school against other schools. But clearly, our school, within the context of national statistics on public health schools, we're short of even the median, and our goal should be to exceed the average, and I think that's got to be established as we think about recommendations going forward. So those are just two thoughts I would have. I'm sure others have got ideas about that, but I think we have an opportunity now with the retirements to make our workforce more reflective of the world around us.
Thank you.
There have been a couple of questions related to the role of white people in, majority or dominant groups, depending on your framework, in this work. And one of the questions was directly about the role of whites and white and Asian people on the SJAC committee, specifically thinking about the internal transformational work that needs to happen. And a related but different question is, how do people that are not experts or very knowledgeable in this work but believe in its importance advance the work? So I want to pose those two questions to the discussants.
So on the, if you can pull up the screen on the leadership team, but the SJAC leadership team is comprised of 12 individuals. And I'm looking at those names. I can just read those names off as Brenda Diergaarde, Tina Batra Hershey, Aaron Barchowski, Andre Brown, Janine Buchanan, Mackie Friedman, Tiffany Gary Webb, Mary Hawk, Marion Jarlinski, Robin Leaf, Sewa Omawali, and Mary Brady is assigned as a staff person. And at least 6 of those individuals are white. So we do have representation on the SJAC leadership team who are white. I also want to comment that what was unique in about this process is that it was a bottom-up process that, as has already been mentioned by our Interim Dean Everette James, is that more than 60 staff, faculty, and students participated in this initiative. So I believe it was the first time that there's been that kind of integration and interface with those 3 strata. So we are encouraging persons who wish to continue the participation, and Tiffany will offer some thoughts on that before we close on the next steps. But we are encouraging individuals who have participated and those who wish to participate to join with any of the subgroups. And there is a timetable for each one of these actionable recommendations. So these are not demands, these are actionable recommendations. They have quantifiable criteria for time and what we wish to achieve in terms of an objective.
Thanks, Noble. I mean, I'll just add to that, and I'd like to hear from Brenda as a non-underrepresented person on the group on her perspective on this. But from my perspective, it took us over 400 years to get in this situation. It's going to take all hands on deck to get us out. So we're going to need allies. We're going to need accomplices, other people to really get, be involved in these efforts if we're going to make progress. So I encourage you to get involved. You don't have to have specific expertise to get involved. We'll find ways where we can use your specific expertise. So, we have recommendations in lots of different areas. You are, on different committees where you have influence on certain things in certain areas. And so there will be a place for you to contribute to this work. So I encourage it.
We've had a number of questions that address how this work relates to the larger university work. We've discussed it a little bit, but I want to ask your opinion in a couple of specific areas. So someone brought up valuing, community engaged work and social justice work, and tenure and advancement and promotion decisions. And how do you envision the work in this department, influencing and being informed by what happens probably in the provost's office and some of those other places in the university? And then that's one. And then evaluating equity initiatives locally and in collaboration with the university. And one of the things that I know has come up and we've discussed in our department is when we have a dispute or a challenge or an issue, can we police ourselves, or do we need an external body to help us resolve those things? So evaluating our equity work and even in specific cases, and then tenure, promotion, values. How do you see interacting with the university, the broader university?
Yeah, so thanks for that question. So there is activity coming from the university level on a number of different levels. So I'm involved in addition to being involved in some of the discussions as associate dean. I'm also on the Year of Engagement committee. So that's led by Kathy Humphrey and Lena Destilio. And so from the engagement perspective and from the diversity perspective, we are having the conversation about promotion and tenure. And so with our engagement group, we met with the new vice provost for faculty affairs. Her name is Luing Wang, I believe. So we talked with her about her plans. And so she's on a listening session now, meeting with different units, because the challenge for her is to think about the actual metrics and requirements for promotion and tenure that, span across the university. So she's listening to the different units and saying, what are the issues in your particular area? I brought up to her specifically that we have a criteria called social impact in our criteria. So could that be a mechanism whereby we can have more attention to some of the issues of community engagement, working in communities, working in diversity issues, and how that counts to the promotion and tenure process. So those discussions are happening at the university level. And I know our Associate Dean for Faculty Affairs, Aaron Barkowski, is very attuned to these issues. And so he will be, involved in those conversations and working on our specific criteria with our faculty and promotions and tenure committee.
If I can follow up, and I might direct this directly to you, Noble. Some have asked about the public health relationship with the broader health sciences and how those interactions might look as you pursue these goals, particularly with attention to student experiences and challenges students have reported, in addition to other things we've discussed. So, how would you see public health working alongside in transaction and transformation with the broader health sciences?
So with the, and this is extremely timely, I'm glad that question came my way, because I would have got jammed up by my colleagues as well as the folks in the community on our Black Coalition for COVID-19 Equity Coalition. So the Black COVID-19 Equity Coalition, that's a group that's multi and interdisciplinary, and it involves folks in the community. And to your question directly, the Federally Qualified Health Centers is an entity that has an opportunity, which we're working with them on in terms of COVID-19, that involves community folk in terms of contact tracing. It involves health sciences folks in terms of the School of Nursing and clearly, obviously, the School of Public Health. And they don't know it yet, but we're also going to bring in the med school and doing some work there. But that's one direct way to have this cross collaboration that involves community folk, the different disciplines in the health sciences, but also the behavioral health sciences, because in your shop, Jay, in terms of the School of Social Work, is integral in terms of what we hope to do also in terms of contact tracing. Tiffany, you want to add some thoughts on that? Because you're deeply involved. That's one area in terms of the Federally Qualified Health Center.
Yeah, so that, I mean, I know, well, that's a great example of how we're connected with our, our outside community. One of the other things I wanted to mention for those who don't know is that we've developed a new committee within the health sciences with the associate deans from each of the schools of the health sciences. And so we're working with Paula Davis on initiatives. And from my understanding, this is the first time that that's happened where we can coordinate some of our activities. We can learn best practices. We can, share resources across the health sciences. So not only are we getting more synergistic within the university, there's a lot of opportunity for us to, take that synergy and partner with our community partners outside of the university. And that's where we can make change for not only, the internal, but the Pittsburgh community at large.
I want to add in here, I think the new Senior Vice Chancellor is very interested in collaborating across all the health science schools and capitalizing on all the talent and the ability across the health science schools.
And also in terms of the Pittsburgh study, CTSI, and what's taking place in terms of the vaccine trials, the health sciences as well as community are involved there as well. And so Elizabeth Miller is involved in that activity. And there are a number of community folk, as well as Alicia Davis with the Allegheny County Health Department. And again, another example, which again, I'm tossing it back to you, Tiffany, in terms of the REACH project and that collaboration that exists with community, the health sciences, and actually the public sector, because I think it's vital that we promote or at least recognize the public sector's role in achieving social justice and equity.
Mm-hmm.
So that collaboration is vital.
Yeah, so I'll just say just a little bit about that so people know about it. It's the racial and ethnic approaches to community health projects. So CDC has funded, Centers for Disease Control and Prevention, they funded these projects for the past, I think 30 years. We just got a grant in 2018 from the REACH project through the Allegheny Health Department to focus on 6 priority communities in Allegheny County, predominantly African American. And so this is another project that is pivotal in our ability to address health disparities, because we're able to, with this targeted funding, focus on these communities. And what we're doing is focusing on chronic disease prevention on a large scale. So food access in communities, physical activity design, and linking people to clinical care. So we have 10 contracted partners across the county who are doing that work. I'm the lead of the evaluation. Dr. Mendez and a couple of our staff and students are involved in that. And in addition, we had 13 more mini grantees. So smaller organizations who may or may not have been able to be at the table for the larger grant, really contributing to that focus. So that's another really big step forward for our region to have a project like that and a federally funded project like that.
I can just chime in too. We're excited at the Center for Raising Social Problems to support your work and Dr. Mendez's work with Jada Sherrill, looking at the association between racism and adverse birth outcomes and how that can be intervened through the Healthy Start work. And so these university public partnerships are great to bring the work that we're trying to do here to the community in different ways. I want to shift gears slightly and talk about training. A lot of questions are coming in around what the training would look like for faculty and staff. In particular, there are a couple of questions around moving people forward that are either resistant or sort of performing and just talking the talk, but not walking the walk. How do you envision making sure training really affects people across the board and not just the people that are already on board, so to speak, and get to the difficult to reach areas and the people that are talking about it but not doing it?
So I have an initial response to that. Noble, looks like you wanted to say something.
No, I'll yield to you.
So I'll just say, one, we can't take a one size fits all, approach for this. So I think we're going to need to think, and we are thinking about this, with Everett, with Eleanor, the Associate Dean's group, the leadership is going to need a little different type of training than we'll have for our larger Pitt Public Health communities. So we've been talking to the Office of Diversity and Inclusion about different options from them. From my experience, again, with the REACH project, we actually had all of our partners trained. We had a health equity training to focus on relationship building and so forth, which is a little bit different because we were all going to work together over a 5-year period with the common goal of reducing disparities. Many of the organizations were white-led organizations that have social justice missions, so to improve hunger or, you know, reduce poverty, but not a specific racial equity focus. And so we embarked on a training with them that was a year-long process where we started out together in a retreat. We did some relationship building. We talked about some history. And then we broke into affinity groups. So, you know, we had a people of color group and a white group. And you know, so it allows you to deal with some of the bigger picture issues and some of the really intimate, specific issues. So I just want everyone to know that we're thinking about training on multiple levels. If you have ideas on things that you would like to see, please definitely contact me, but this is a priority for us and we're working on this right away.
I'm raising a related question, and it gets to accountability, and there's a comment with it. There is very little accountability in academia, period. Title IX was passed almost 50 years ago. But we can still barely hold sexual harassers accountable for their actions, or educators continue to teach classes. In academic forums, we are all very good at getting up and expressing outrage at the systems, but then everyone goes back to their 10,000 duties as faculty and few things actually change. How can accountability in this be different? How can accountability be more than just calling out and looking sternly at someone who failed to do a thing they promised to do?
So that can be built into the evaluation of faculty in terms of embedding equity and social justice metrics in the evaluation of faculty. So in addition to embedding content, equity and social justice content in the curricula, but also in terms of the work that the faculty do. I would also say this harkens back to someone's recognition or concern about the you know, how are we going to assure that we have these goals and objectives met? And again, that's going to be in our recommendations, that we have these goals and that there are criteria that actually measure whether or not they're achieved qualitatively in addition to quantitatively. So the equity audit that Tiffany referenced, I think that will be a way to systemically have accountability in terms of the respective departments. And also, I believe Tina mentioned the service piece, the work that the social justice work that faculty are doing. So that should be that should be acknowledged in terms of our faculty's evaluation and work.
Yeah, I was just going to jump in here and say that I think the accountability piece is tied in with that service, that recognition for the service piece. That when the recognition happens, then I think some of the accountability will follow that.
So we have a question about a pipeline for underrepresented students. Can you speak more about suggestions in the report for building a pipeline of underrepresented minority students from high school, undergraduate, graduate, postdoc, and faculty? What is the likelihood that these suggestions will be implemented? Will resources flow to departments, or will this be centralized?
So So my experience with our existing pipeline programs has been as a faculty member lecturing in those programs. So we have the Investing Now program for high school students. What they do is they rotate between the schools of the health sciences, and each school takes a couple of days. I asked Laura Ann Bray, who helps our school lead that program, to chime in on the chat and give a little bit more detail. So that's directed at high school students to kind of get them exposed, because remember, our discipline is primarily a graduate level discipline. So your exposure to it, you know, it needs to start a little bit earlier if you're going to, you know, think about doing that. I've also done some lectures for some of the summer programs that have been involved in the School of Medicine, out of Dr. Pettigrew's office with Paula Davis and so forth. So we do have some existing programs, and I believe those are targeted towards undergrad students. What we want to do is try to increase those pipeline programs. So some of the ideas that have come up, you all should know about the diversity supplement mechanisms. Noble has been talking about those. We want to reconvene the committee to really work on using that mechanism. We are such a research intensive school. A lot of us have eligible grants that can be funding people, and it's a pretty short and not too labor intensive process to apply for some of these mechanisms. I can tell you, I was a recipient as a master's student more than 20 years ago. So these, I would not be here without some of these pipeline programs. I've been in pipeline programs since I was in high school, prior to, getting me ready for college, and then in college, getting, research experience, and then getting, prep to grad school. So I can't tell you the importance of them. Unfortunately, a lot of the programs that were out when I was training were federally funded programs that don't exist anymore. So I think we have to try to revive some of those programs, coordinate with the existing programs, and then think about creating new programs. So the existing programs I talked about, and then Tony DeLucius in EOH, he is interested in building on the existing programs and being a little bit more focused on our schools. So we have a couple of things between Tony's program, the existing programs, the diversity supplement committees, and then I'm blanking on the last thing, but we have a good start as to trying to increase the pipeline.
I'll add a couple of thoughts to that in terms of the pipeline piece. As Tiffany mentioned, the diversity supplement. The success that we've had at Pitt Public Health has been, now will be expanded throughout the health sciences. Steve Reese is more or less picking up or expanding on the work that we did here at Pitt Public Health. And so we'll be working with him on that. And additionally, what's unique about the diversity supplement is it also provides opportunities for undergraduate students as well as high school students. So that we're going to develop, at least figure out how we can expand that or enrich that particular dimension. And Paula Davis is working with us in that regard. I would also state that we did some work where we looked at the life expectancy in selected neighborhoods in Pittsburgh and Allegheny County. And as many of you know, the range of that life expectancy was as low as 62 years of age in Larimer and as high as 84 years of age in Highland Park. What we've found through the Centers for Disease Control determined that a high school diploma, having a high school diploma will add 10 years to one's life expectancy. So what we're looking at is, in terms of these collaborations and strategic partnerships with the public sector, is to figure out what's going on in our education system and what can we do to not only address the physical health, but more importantly, the pre-existing social conditions that exist in those respective communities that are drivers of premature death. And one of those drivers, as I mentioned, is the education piece. So let's look at collaborating and work with the Pittsburgh Board of Education, with our partners with the Center for Urban Education and the Department of Education, and of course in the health sciences, and figure out, okay, what can we do to address those issues? And so a pipeline can be developing high school programs that would provide jobs, because in your area, Jay, I believe the center there discovered that for African-American males, 18 to 36, 48% of those individuals did not earn one nickel over an 11-month period. So that goes with jobs. So if we can figure out through a collaboration that we, in addition to providing jobs, summer jobs, we can develop some collaboration with our respective partners at the university to have these summer enrichment programs, such as the Upward Bound program. Additionally, the schools at Cheney and Lincoln, at one time, if you were a graduate of Cheney and Lincoln, you received a full scholarship, tuition paid. And so now we're working with the state legislators to resuscitate those programs. So those are kind of pipeline programs that would include the Allegheny County Community College, and figure out ways to connect those so that those issues around the social environment and employment and living wage. And then lastly, again, Richard Garland, on the work that he's doing in terms of vocation, because all of our folks aren't going to be going to the university. So when we talk pipeline at the high school level, let's look at vocational programs and training as well. And I would also mention that UPMC could be a valued partner in this regard, and I believe Richard is working with them to do some things there in terms of apprenticeship programs.
Thank you for those responses. We have a couple of questions about the dean search, and will the new dean, the degree to which the new dean will adopt and act on these SJAC recommendations, and a related question around how dean candidates, how much they are engaged and supportive of these efforts and the broader efforts in the university. So to the degree that we know the answer to these questions, how is this work factoring into the dean search transition?
I think Tiffany is on the search committee, or was on the search committee. So I'll let her start, and then I'll give you my insights, as limited as they may be.
Yeah, so I'll say that we did ask the candidates about their vision and thoughts related to diversity, equity, and inclusion, and talked about the work of our Social Justice Action Committee. So my plan would be, as soon as the new dean is named and implemented, to share the plan, share the priorities that we'd like to implement and move forward. So I expect that the candidates that we talk to would be very, very open to implementing a lot of these action items from the plan. The question would still be to be determined are resources that will be, allocated for this process.
I think, from my perspective, I can tell you that I personally shared the SJAC report and the letter to the dean with the finalist candidates, and have spoken with each of them. And I think at this point, I can safely say that all of the candidates seem to understand the importance of this from the school, the faculty, staff, faculty, and students perspective, that this has to be a priority. This is a priority. And I think they're all embracing it in their own institutions where they're currently working as well. So, you know, I feel very good about, at this point, about the finalist candidates understanding that this Social Justice Action Committee and its recommendations are part of the fabric of the school now, and they are a roadmap for the future. I do want to thank Tiffany Gary Webb for taking the responsibility of becoming the Associate Dean for Diversity, Equity, and Inclusion. Is that the right title?
That can be the new title.
Okay, we got to work on that. But I want to thank, I did want to thank you as well. I know you were integral to the SJAC, but you know, I think Tiffany is the link between the committee report. She was on the search committee for the new dean, and she is going to be responsible for helping us drive these issues in the school. I'll continue to work on this as a faculty member alongside with all of you fellow faculty members here when I return to my faculty role. But yeah, I think, Jay, we can safely state that the candidates for the dean's job will embrace this set of recommendations, and they'll be working closely with Tiffany to move implementation of those that we haven't already gotten underway before that time frame.
And I would just add that we're about ready to close. So Tiffany, I think, and Jay, we might want to move towards the next steps. I think that's a good segue into the next steps, Dean Everette.
I'm good. Thank you all.
Okay, let me just share my screen again. Okay, so thank you for the discussion. We just wanted to leave you with some of the initiatives that are happening at the University of Health Sciences, at, you know, things that are already happening, so that you could get a flavor for the commitment that's coming down from all levels of the university for these issues. So at the university level, the senior leadership, which is the chancellor, vice chancellors, provost, vice provost, and all of the deans of the school, the different schools, did a 2-day anti-racism retreat where they discussed what the university can do to become more anti-racist. They listened to experiences of Black faculty, staff, and students. And so that is where you really see from that retreat, lots of activities. So one of the kickoff activities was a diversity forum that happened in July. Angela Davis was a keynote speaker. Dr. John Wallace from social work has been named the vice provost for faculty diversity and development. And so he's working on a number of initiatives, and I already mentioned the course on anti-Black racism. So just also letting everyone aware that the Office of Diversity and Inclusion, they have a specific website to catalog all of the activities that are happening. So please go visit it. It's diversity.pitt.edu/social justice. And just out this week, the university put out a diversity dashboard in the name of transparency of all of our diversity numbers. They're even looking at some of the vending and so forth. But you can go and explore the website. This is the numbers for our Pitt Public Health community. So this is 2010 all the way to 2019. And so right now we're at about 18% Asian faculty, 6.5% Black faculty. I think this is probably about 2 to 3% Hispanic and international, and then 70% white. So you can explore these numbers for any unit in the university, and we want to, try to have some transparency with our numbers too. So we'll be working on sharing some things as well, and trying to do a website. From the health sciences perspective, there are a number of activities. So students had demanded that there be a committee to review the naming of Scaife Hall. I talked a little bit about some of the hiring. And then from a curriculum student perspective, there's going to be new dean scholarships that will cover 4 years of tuition for up to 3 underrepresented minority students. So hoping to think about whether we can do some type of scholarships in the public health area too. And then as we've been talking about, we are here at the School of Public Health, we want to follow up on our priority recommendations. So if you have specific ideas of things that should be priorities, please let me know. We want to do anti-racism trainings. I saw a comment in the chat that trainings is not very inspiring, and Office of Diversity and Inclusion agrees with that. So we're calling it ongoing diversity education. And so we'll look forward to having some of those things happen. And then I talked a little bit about the race focused cluster hire, which will have more information at some point. And then the anti-racism course will be open for other faculty, students, and staff to view at some point. So those are just what I had to share, and I want to thank everyone for participating in the process. It's difficult with the, yes.
I was about to say, offer some thoughts in terms of the posting of the report, and they can track the progress of the SJAC because it'll be on the website. Right.
So that's what I was mentioning when the Offices of Diversity and Inclusion put up their website. We want to develop something similar to that for Pitt Public Health. I have a conversation with Caitlin next week to talk about how we can have a website where we can post our, some of our data, our recommendations, and as things happen, be able to populate the website with our activities. And so that will not only just keep people abreast of what's happening, but also serve as a way to track our accountability, because, we're talking about, implementing some of these things. And so we really want to, track it and show that we're actually doing it. So I just want to say, I know that it's difficult to have these discussions in the virtual format, and I think we did a very good job, thanks to Jay, to moderating for us. But this is just the beginning of the discussion, and so there will be plenty of opportunities to stay involved. I hope those of you who were actually involved in the working groups will continue to be involved in some way, and we'll let you know the opportunities to stay engaged. So thank you. Anybody else want to say anything else?
Thank you to everyone who participated in the work groups and who joined us today for the town hall.
Mm-hmm.
Thank you.
You.
For having me.
Thank you.
All right. Bye-bye.
Stay